found that the model of Western medicine was still very helpful, and I wanted to be a Western-style doctor, but I knew it wasn't enough.
Providing healthcare is an experience, and unfortunately it's been broken down into procedures and silos, departments that sometimes no longer talk with each other.
The Osher Center is really about connecting people, connecting the body. And integrative medicine is more than just adding alternative medicine to conventional medicine. It's really arriving at a deeper understanding of physiology and medicine that connects both.
There is a belief in an innate ability of the body to heal, and we want to do anything we can to enhance that mechanism, drawing on any traditional medicine that works, so it doesn't have any one route, but always looking at the science behind anything we do.
Wow. Yeah. This is one band that runs right down.
My jaw gets tense, my whole neck gets tense, and it all relates to each other. I think it was brought on by stress, is what I sort of realized. And it was actually physically changing the front of my neck. Once you recognize that that's what's happening to you, it becomes a little bit easier to say, okay, what am I going to do about that? And how am I going to change?
It's a great question to think about with someone, how they've approached their illness. Because everyone has a notion as to what's wrong. In fact, one of my questions now for just about everyone is, so what do you think is going on? What do you think is wrong? And I add in, what did Dr. Google tell you? Because everybody goes online nowadays.
Have you always had anxiety? Have you ever had acupuncture before?
No.
Never?
No.
Okay, good.
Oftentimes when we examine a patient, the patient will say, that's the first time someone's ever put their hand on me or ever touched that spot and reproduced my pain. And if you can identify a tissue, an area, a movement that then can reproduce a patient's problem, they have the confidence to say, hey, maybe you can do something about that.
I'm a good patient, you know, if you tell me what to do, I'll do it.
Yeah, that's when we make teamwork.
Teamwork, that's right. Everyone's making me feel better.
Pain is not our enemy. I usually talk about it's almost like our bodyguard. Of course, nobody really wants pain. We're not against any medication, including pain medication, but the most important, we are not stopped there.
Okay, so my case was such a good example of a really debilitating ailment that medication could not help. Doctors gave me meclizine just so I could get out of bed. The larger problem though came from a neck injury that I had, and that's what she treated me for. If I move my eyes around, you can imagine during the day you're driving, you're tracking, you're watching people walk. That made me profoundly dizzy, and it was petrifying. It was really debilitating. I probably shouldn't have been even trying to drive or things like that, but I have 3 kids, and I'm 47 years old. I want to be active. I want to keep exercising. I know that I have a practitioner that I can go to for help, but also that's teaching me how to read my own body in a way that my other doctors just couldn't.
I do a lot of driving, and so when I'm in my car a lot, I realize that, you know, if you're holding onto the wheel too tight, and then then that starts my problem, you know, and so that's like, one of the things I realized, I was listening to sports. I do listen to a lot of sports radio, and then the arguments with people calling in, I was like, why am I listening to this? It's causing me more stress. A lot of times now, I don't listen to anything, and while I drive, I just drive. It's a little peace and quiet.
I was introduced to the Osher Center by my doctors, and I am a burn victim. I receive deep tissue massage, grass stone therapy, chiropractic care, craniosacral, because the massage help you with depression.
The other area I work a lot is anxiety, depression, all kinds of emotion-related tension. Also like PTSD cases, like trauma, can be physical trauma, emotion trauma.
When it came to a point when I needed touch, I didn't know what to expect. The minute you're on any type of narcotic, the first things you suffer is bloated and constipation. Massage promotes circulation, gives muscle tone. Massage is very beneficial for maintenance.
Any burning sensation when I stretch the calf?
Yes.
Okay. And is the burning right in the Achilles or is it higher up in the calf?
It's right in the Achilles.
Yeah, right in this area. Mm-hmm.
Yeah, right there.
Yep, we'll work it a few different ways here.
The hands are diagnostic here. People use touch to figure out what's wrong. Almost all of our folks do that. You know, G, for example, never reads the medical record until after she's had her hands on somebody. That's how she diagnoses, and that's how she wants to know the person first. The hands are diagnostic, the hands are therapeutic. So Arthur will say, okay, stand this way now. Can you feel that? So the hands are teaching as well. That's an educated touch in the same way that a radiologist has an educated eye, an educated gaze. It is very systematic for each of the professions.
You know, right now, I almost feel in the back, around T6, T7 there, they have some like twist movement. Because our body is a unit, it's all connecting together. The example I show is like you can see the alignment in different directions, but your pain not necessarily come from here, but you can feel here, you can feel here, you can feel really on distance. The beauty of this work is just to follow your body, let your body guiding you through the fascia, through the fluid system, through the cranial rhythm system, to try and as precise as possible to find where the fulcrum to get this tension release. They'll be fine.
Some of the ways that these therapies may work are less clear. And so the role of research is not just to prove effectiveness or to evaluate effectiveness and safety, but to elucidate or identify plausible mechanisms that add to the credibility.
We're investigating neck pain more now and headaches, which are some of the other big classifications that chiropractors treat. But there's also research being done into chiropractic treatment for other non-musculoskeletal disorders, irritable bowel syndrome, even otitis media, the inner ear infection. So these are all areas that chiropractic has been applied that needs to be investigated further.
A lot of the manual therapies, for example, are really manipulating the connective tissues, the fascia that surround the muscle, and acupuncture also has an impact on connective tissue. And some of the pain, some of the pathology may be actually coming from those tissues. And this translates into changes at the cellular and biochemical level that we're very interested in. But there's also whole systemic effects that can have an impact on a psychological level. So all of these changes from the local all the way to the systemic and the mental and emotional come into play.
Just like you open your hands, open your spine and back and chest. Like your whole body were a palm.
So we were doing a study now with women who are postmenopausal and have thinning bones. And we're asking whether Tai Chi can reduce the rate that these bones lose their density over time, but also interested in their balance. So we collaborate with a traditional laboratory that does x-rays of the bone density at one hospital. We work with another laboratory that studies their gait and their biomechanics. We're very interested in how they maintain their balance, not only while they're standing, but while they're walking and rising from a chair. People get wired up and we can assess their biomechanics both before, midway through a 9-month course of Tai Chi, and at the end.
I think the reception of conventional audiences to the results of our research is completely dependent on the quality of the research that we do. In other words, if we're interested in looking at back pain, whether it be acupuncture or whether it be physical therapy or whether it be a drug, that will not matter to our conventional audiences as long as the study was done in a high-quality way so that an answer, a clear answer, was provided that they believe is valid or true.
20-30% should be in your feet and the connection to.
Coming from the perspective of a clinician at the Osher Center, surgery is alternative therapy. Drugs, injections are alternatives to us. You go down 2 flights to the pain clinic, we're an alternative to them, which I think is fine.
Both of them got their places. Natural medicine will not give me a grafted tissue, but natural medicine took me out of the narcotic at an early time and bring me the way I am now.
so many things as we age, especially and in chronic disease, just don't light up on any of our fancy equipment. And I might say, I don't know how this works, but I've seen a lot of folks with your kind of pain get better with acupuncture. I don't know how. Let's try it.